we've been doing healthcare for social media for quite a while now, and it's definitely tough. It's much harder than most other verticals. One of the reasons for that is the HIPAA compliance. One bad post and you're violating federal law. So that can get intense, heavy, and be cumbersome. So today we're going to talk about what makes a good social media agency and what makes a good social media agency a fit for healthcare. We've had three different clients that we're going to talk about today, which is GoHealth Urgent Care, Baptist Health, and 5410. We have seen what basically blows up those HIPAA landmines that nobody's going to warn you about. There's a difference between marketing for patient acquisition or there's a difference between marketing for patient acquisition. Jesus Christ. There's a difference for marketing between patient acquisition and then recruiting for these companies. And then some of the other things that we've just learned in and around this space and some of the best practices we've seen that have actually translated into great results for these companies. So the big problem here is that healthcare is social media on hard mode. So what are some of the things that make this hard, Joanna, Jason?
Yeah, I think what makes it difficult is, like you mentioned, HIPAA compliance. It can kind of sneak up on you, and social media is such a casual place. It's a place of community and speaking to those who interact with your business. And when the people who are interacting with your business are protected by HIPAA laws, you have to be very careful how you interact with them, if you interact with them publicly, right? So
Yeah.
healthcare is one of the most challenging verticals to navigate social media wise.
Yeah, 100%. The other thing too is a lot of these big healthcare companies, you're working with a department. You're not necessarily working one to one with like just the marketing person. So you're working with certain roles inside a bigger marketing department. So making sure that communication is seamless, that you are picking up all the conversations that are happening, being a part of some big team meetings. Like we've been a part of, I think for what was it, Go Health, we were in monthly calls, and how many other people were in that meeting with us?
I mean, we
Like,
had an in-person meeting with about twenty people
yeah,
once. So
exactly. So I mean,
there's a lot
it's
going
not,
on.
yeah, there's a lot going on, and making sure that that line of communication is managed correctly is also um, a big um, a big gap here that a lot of companies do miss and can be actually burdensome down the line. So let's talk about the HIPAA compliance stuff. Obviously can't share data, that type of stuff, but there's little ways that this actually creeps up on you, right? So any ones that you've seen in particular that stood out for you?
Yeah, I think what I alluded to before was is probably the most common HIPAA compliance issue that social media managers for healthcare clients would run into, and that's community management and moderation. Let's say you do social media management for a dentist's office or a doctor's office, and someone comments and says, "Oh, these guys are so great. They've been, looking after my daughter since she was born." Um, Commenting back and saying, "We're so happy you've had a good experience. You've just confirmed that they're a patient at the practice, which is not compliant." So something as innocuous as a quick interaction in the comments can get you into real trouble. So that's probably the most common or most accessible mistake you can make. I've seen some crazy things that are a lot more obviously wrong, like nurses filming TikToks in hospitals that are recognizable. Maybe keeping the name anonymous of a patient, but describing them in such a way that makes them um, recognizable to their followers or to the viewers.
Hmm.
Um, yeah, things like that. There was a case where some surgeons took a photo of body parts that were removed during surgery, and the patient was in the background. I mean,
Oh,
it goes all the way from innocuous to pretty obvious. But yeah, pretty crazy.
yeah,
Yeah, you want to make
yeah,
sure that you're working with an agency that has your back. I mean, I think part of the reason that we kept a lot of our health clients for as long as we did is just because we made the commitment to making sure that we got acclimated quickly, but then also acted as a safety net for them so that nothing they knew that they were protected and that, we weren't going to do anything that was questionable, or at the very least ensure that they have first right of refusal on anything ever being published. So it's important to
Yeah.
have an outfit that thinks that way from the beginning of the relationship throughout.
Yeah, 100%. I mean, we built out a compliance playbook for this, so we were able to keep workflows at a speedy process. Because when you're trying to get confirmation and you're not sure maybe who to get that from, B, not sure what's correct, those things can lead to big bottlenecks. Sometimes taking approval processes weeks as opposed to days. So HIPAA compliant doesn't mean you can't do social media. It just means you have to be smarter than everyone else when you're doing it. So compliance is a frustration, but let's talk about two completely different games here in the healthcare space, which we've seen a few times. One is patient acquisition versus employee acquisition.
Yep. Yeah, so we've worked with both. We've had experience with both, and they're completely different strategies. So healthcare is unique in that, a lot of other businesses, you are not just trying to reach people where they're at, you're trying to convince them that they need your product or service. Whereas healthcare is a little bit different. You don't necessarily want people to need your service. What you want is for them to reach out to you when they do need that service. So it's more just an awareness play. We're not targeting users based on how sick they feel. Rather, we're targeting users based on their location and making sure that they know that, their neighborhood urgent care is located in this shopping mall or this shopping center, and just using awareness as opposed to reaching people and trying to get them at the point of action.
Yeah.
Whereas recruiting is a different story. We're talking more about the culture of the business, culture of the hospital, or culture of the healthcare in whatever space it's in. We're talking about the life of the employees, the current employees, and we're trying to entice new users, and that's a lot more action oriented. So we're reaching people where they're at. So if you have a job title as a nurse and you're in the market for a new job, that's when we're delivering ads or content to you.
Yeah. Yeah, and again, they're two completely different strategies. And depending on, we've seen, well, especially with that recruiting piece of it, we've actually seen the where doing this on social almost results in better recruits actually applying for the jobs, or as opposed to some of those job boards, right? Like um Glassdoor, Indeed, etc. Because you're able to kind of target them with culture and messaging and warm them up. And then basically with our process being able to give give a couple filter layers to vet people. So when people are showing up to these things and filling out these applications, it's just a higher quality recruit. So what actually makes healthcare social work? So we're gonna, I guess there's a few content pillars that we try to base things off of. Story architecture matters a lot, what you can and can't say, but ultimately it is still social. So we do want to tell stories here. Just figuring out content pillars, working on the AI versus the human play, and then speed to publish, making sure that you're still having consistent, great content that's flowing out of the organization is incredibly important. But let's take a minute and talk about the story architectures.
It's important. I mean, I think it's not any different than practically any other industry. I think the if you're looking for an agency to best support you, not only the compliance things that we've been talking about, but you have to be an active participant. Like if your goal is to not look at it or touch it or not participate in any capacity, you're making it very difficult for an agency to represent you and to be authentic. So I think you have to go into a relationship expecting to provide some raw material or direction. I think the clients that have worked best with us have been active participants because they've got an interesting story to tell, and that makes an agency's job easier. If you're not doing something interesting or different or unique, it's very hard to keep people's attention span. So no matter what, I think it's important that the ones that have worked best for us are the ones that have given us something to work with.
Yeah. Yeah, 100%. And that translates to the content pillars, right? Directly. For patient acquisition, health and education, one of the biggest content pillars. And just because it's healthcare doesn't necessarily mean that there can't be some sense of fun to it. It doesn't have to be very, very gray. It can be, black, or I should say very black and white. Like you know, it's still storytelling. People still want to get engaged. So there still has to be some fun element to that content coming out. The other thing's big is provider credibility, talking about patient experience in an innocuous way, being able to tell patient stories anonymously.
Yeah, and I think they can be formulated from a mixture of stories, right? So you can talk to the urgent care center and whatever their patient group they're looking to raise more awareness in. You can kind of formulate a story. We used to do this. We would take multiple patient stories, multiple patient reviews, and kind of blend them into one, so it wasn't recognizable. And then you kind of produce it out. So it's true. It's just not. It's just HIPAA compliant.
When you're talking about recruitment, and we touched on this before, and why we were able to deliver better results than platforms like Indeed was because actually you can take that content and actually mold it around the culture, mold it around the job. Instead of patient testimonials, anonymous patient testimonials, you can have other nurse testimonials, other doctor testimonials, kind of talking about how great it is to work there, a day in the life. In healthcare social media, trust is the product. Every post either builds off of it or it destroys it. In the healthcare industry, if you're thinking about bringing an agency on board or building this in-house, these are the types of things you actually want to look for. The pitfalls are large, but the upside is great as well.
Um,
Joanna, jump in. Tell me, what does this mean when people are
yeah,
when people are
so
looking to make a decision?
yeah, when you're looking to make a decision and you're questioning, you have questions for the agency or whoever it is that you're working with, I think it's important to start by asking about the compliance workflows. So not just asking them if they have experience with HIPAA, but what does their content approval process look like? What safety barriers do they have in place? And what examples can they give you of some things that they've run into and that they've, maybe protected a previous client from before?
100%.
Um, as for healthcare specific results, I think we've summarized this well, but throughout this whole podcast, we're talking about how healthcare is probably one of the more difficult verticals to work in. So you want someone who's has experience in that space. Clarify your goals as well, because that'll kind of dictate your strategy as a whole, right? Are you trying to get more patients? Are you trying to get more patients in a certain for a certain service that you offer? Or are you trying to recruit more healthcare workers? They're just completely different strategies and approaches and safety precautions. And then don't just settle for an agency who says we've done healthcare before. Really ask these questions, dig in, get to know how experienced they are with HIPAA compliance and community management and
Mhm.
strategy as it relates to different objectives.
Wrapping this up, healthcare and social media is absolutely doable. I mean, we're very proud. We've done it pretty well in the past. We're not the only company that's done this well out there. There are a couple of others, but I'd say, it's not the norm, that's for sure. And making sure that you find somebody that has a track record in this area and that can answer some of those questions and talk on some of those topics that we brought up today, I think will go very far for making sure that you find somebody that's a great fit. So that's about it. That's going to be a wrap for us today. I hope that was helpful, and let's do some social media.